The consequences of not getting epilepsy surgery, the consequences of not having your seizures controlled. We know that there's something called SUDEP, sudden unexpected death in epilepsy patients. We know that patients get in car accidents, they get burns, and they drown, and they have all sorts of complications. I mean, epilepsy is a pretty devastating disease. It affects not only the patient, but the family and the friends and the whole entire social circle. So one of the benefits of doing surgery and the benefits of being treated at another center, if you feel you aren't fully appropriately treated, is that at a level 4 epilepsy center, we know all the latest and greatest treatments that are available, both medication-wise and surgically, and so those patients, we're able to provide very good care. A lot of the times, one of the big fears is that when a patient gets referred to a level 4 epilepsy center, that it becomes a black hole and that patient is gone forever. And at least at UC Irvine, where I am, we really make it a point to work very closely with the epileptologist or the neurologist who referred. And most of the times what we end up doing is we work with the epileptologist, we do the surgery for the patient, but then we work to transition that patient back to their epileptologist or neurologist. The communication element of it is very, very important. And so, like I said, I can speak for our center at UCI, but we are very, very, it's very important to us that our referring docs, understand what's happening with the patient, know where the patient is along the process. One of the things we don't do is, if you refer a patient and appropriate video EEG and imaging and all those things have been done, we don't repeat those studies if they're appropriate and good quality. Part of what we've noticed is that people will get sent to centers, the entire workup gets repeated, and then at the end of it, they don't know what happened with that patient. So one of the things we're very good about, taking all those things, working with the epileptologist. Once I do the surgery, I follow the patient, from then on, from the surgical standpoint, but our epileptologist will follow them in the perioperative period and then work to transition them back to the epileptologist.